So we're going to be using your Echo Sidekick tool to work through the knee to improve range of motion, work through any pain that you may be having there. So essentially what we're going to do is just bring that knee down a little bit, Dallas. Now knee pain can be caused by multiple reasons. Sometimes it'll come from IT band issues, patellar tracking issues, and we'll get tendinopathies, things like that through the knee. And so we're going to kind of touch base on a few of these things and how you can use your Sidekick tool to really help you get some relief. So we're just going to apply the warming spray to the quad, the joint capsule, the knee, and Dallas can go ahead and start using that Sidekick tool to work through the tissue. And she's using the inside edge, just works as a really good contour around the knee. She's following all the way through the joint capsule, working through the tendons, infrapatellar tendon here, up through the quads. And so just allowing the tool to guide her, and wherever she's finding some areas of redness, petechia, she's just going to spend a little bit more time there. And she's making sure she's using that tool in both directions. And so even though the tool is pointed down towards her knee, even as she brings it back, it's still effective in working through that tissue. And so we can use, and the smaller edges around the knee. And same as with the ankle, we want to avoid any of the bony protuberances. You don't want to be going over that with the tissue. And as you work through suprapatellar tendon, infrapatellar tendon, we'll find a lot of tension here that actually, the cause of it will be coming from the quads and the hips. And just, and you can be a little more assertive with the tool and just a little more aggressive with it as well. But we do want to be cautious because of the bursts that are there. And so working through the tendons themselves, through the musculotendinous junction, and I'm just going to take over for a second, Dallas. And we want to, especially where these tendons transition into the muscle of the quads, we're going to find some areas of adhesions there. And so we want to really spend some time working through that. And then go ahead and just drop your leg off the side of the table. And so what we're doing is putting that quad into a stretched position. We're stretching out the joint capsule. And so it's really effective to work through that tissue in multiple angles. And so working through it in both stretched as well as shortened components.